Hi, on behalf of myself, Mary Ann McDowell, and my co-host Heidi Beidinger, welcome to the 10th week of Consider This, Simplifying the COVID-19 Conversation. This week we'll be hosting Dr. Bob Einters, the St. Joseph County Department of Health Officer, and be talking about all sorts of concepts about public health, but in particular how the county's getting ready to deploy the vaccines that may be coming available. So I thought I'd give you a brief update on the vaccines that we think will be distributed soon and some of the concepts. So first of all, the idea of vaccine efficacy. What does that mean exactly? Well, vaccine efficacy is a risk ratio. So it's really the proportionate reduction in disease attack rate if you're vaccinated or not. And so I'm going to give you some examples of that. So the risk ratio is calculated by as a ratio of the attack rate of the vaccinated group, or the ARV, over the attack rate of the unvaccinated group. And so how do you calculate attack rate? Well, that's the number of cases in the group, so whether it be the vaccinated or unvaccinated group, over the total number of cases. And then the vaccine efficacy is 1 minus the risk ratio. And it's actually presented as a percentage, so 100, minus whatever the other percentage would be. So let me give you an example. So let's say we have a vaccine and we've vaccinated a group of individuals, and importantly, the number of people vaccinated has to equal or approximately equal the number of individuals who were unvaccinated to make this calculation efficiently. And so let's say there was 100 cases that came up, and only 10 of them were in the vaccinated group. So the ARV would be 10 over 100, and the ARU is 90 over 100. And so if we want to calculate the risk ratio, we have put the ARV as 10 over 100 divided by the ARU, which is 90 over 100. So if you remember your high school or junior high math, when you have a division with a ratio like this, you actually flip it over. So then it's 10 over 100 times 100 over 90. And so what happens then are these two terms cancel themselves out, and you have 10 over 90 or 0.11. So you can imagine it's easy to do in this particular example. You could do the division up here, right? So this could be 0.1 divided by 0.9. You can't use the cursor very well. All equaling the same. Let's get back to my pointer. And so then to calculate the vaccine efficacy, you take 1 minus 0.11, which equals 0.89 times 100 to do the percentage. It's 89% effective. Now, vaccine efficacy can change over time. And so we're hearing how effective these vaccines are right now, but this is really early after the vaccination. And we know that immunity can actually wane or get less over time. And so that's why it's really important to keep these clinical trials going for a long period of time. One, to look for safety of the vaccine, but also to see how effective the vaccines are over time. So let's imagine a year later or 6 months later, we look into the group again and we have 200 additional cases. This time 65 in the vaccinated group and 135 in the unvaccinated group. So let's do our calculations. Our risk ratio now would be 75 over 225, 65 plus 10, over or divided by 135 plus 90 equals 0.33. And then that equates to a vaccine efficacy of 66.67%. So as we go on and more people are vaccinated and time continues, the VE might actually change with time. So let's talk about what vaccines that we have available. So the first one is Pfizer. And Pfizer is actually, I'll move that out of the way, an RNA vaccine, a nucleic acid vaccine that encodes the spike protein of the coronavirus. And it turns out it's quite effective. So their clinical trial involved 2 doses, this is important, with about 44,000 participants. A diverse group, which is also really important. Plenty of people who are a little bit older, and I can say that because I'm nearing that age. And they've done this globally as well as just in the United States. So what are their results? Their interim results, or what they've looked at so far. 170 COVID-19 cases. 162 of them were in the placebo group or the unvaccinated group, and only 8 cases were in the vaccinated group. There were 10 severe cases. 9 of them were in the unvaccinated group or placebo group, which is good, but it's not 100% effective in that way. And so if we do our calculations, the VE is about 95%, which is more than we could have imagined. I mean, the FDA was going to approve vaccines at 50% effectiveness. And in some years, the flu vaccine is only 40% effective, depending on what flu strain is circulating in the population. And that can be effective as a public health measure. So this is pretty incredible. They are having an emergency use authorization meeting on December 10th, which is coming right up. And they think that if they're approved, that they could start shipping some vaccine doses on December 11th, with some people being vaccinated by December 12th or mid-December. So importantly, this is a nucleic acid vaccine, and it's very labile. It can degrade very easily. So storage is really important. So these vaccines for long-term storage need to be stored in ultra freezers, minus 70 degrees Celsius, which equates to about negative 94 degrees Fahrenheit. There's a lot of these freezers in research labs. I have a couple in my lab, but not many hospitals or clinics have these. And so I think some of the first distribution points will be places that already have these ultra low freezers. Pfizer has worked out a shipping container so that they can keep their vaccines on dry ice and keep them stable for at least 10 days. And then if the clinic or hospital doesn't have one of these ultra low freezers, they can continue to put dry ice in the shipper and keep the vaccine stable for an additional 15 days. Whoops. Importantly, that once they thaw the vaccine, it's only stable for 5 days. So that vial has to be used within 5 days. So the next one that we've been hearing a lot about is Moderna Vaccine, which is also an RNA vaccine that encodes the coronavirus spike protein. And its study population, or its clinical trial, also involved 2 doses, 30,000 participants, a diverse group, just as with the Pfizer group. And in their case, their interim results had 196 COVID-19 cases. 185 of them were in the unvaccinated or placebo group, and 11 in the vaccinated group. They had 30 severe cases and 1 death, but that was all in the placebo group. And this is just a distribution of some of those cases. So if you look at the vaccine efficacy, it's 94.1%. Again, unprecedented, fabulous result. They have submitted their application for an EUA or emergency use authorization, and that meeting is on December 10th. And again, they hope to ship quickly after they see approval. Nucleic acid vaccine, it does need to be stored long-term at minus 70 degrees. I was unable to find some information on how long that storage will last. My guess is since they started studying it, it's still stable. Importantly, they've tested this at minus 20 degrees Celsius, which is about minus 4 degrees Fahrenheit, which is like your freezer at home where you keep your meats, frozen meats and vegetables, etc. And it's stable at 6 months. So that's quite good. And stable in standard refrigeration, which is 2 degrees Celsius, which is about 36 degrees Fahrenheit, but it's stable then for 30 days. The other one we've heard about is AstraZeneca. So AstraZeneca is actually a viral vector vaccine with the adenovirus that causes common cold, but actually a chimpanzee adenovirus. And the way these vaccines work are you're infected with these viruses, but they're attenuated, or so they don't last for very long and they die out, so they don't maintain an infection. And it encodes the spike protein of the coronavirus. So AstraZeneca has a whole bunch of different studies all over the world. They're planning on up to 60,000 individuals, but this preliminary analysis, I think, only involves about 12,000 individuals. They have a study in the UK, which is, I think, about 12,000, and maybe 10,000 in Brazil. I don't have those numbers exactly right. They have not provided a lot of information. So what I'm telling you here, I'm just gleaning from reading lots of different studies. We do know that they made a mistake early on and miscalculated, and a small number of individuals were only given a half dose followed by a full dose, and which the clinical trial originally wanted to do 2 full doses. So what were their results thus far? They've had 131 cases, and they report no severe cases in the vaccine group. That's all I could really find out. And I kind of back calculated. So based on, I think, these 2 groups here, they're saying it's an overall 70% efficacy. So I've kind of back calculated and assumed that there were 30 in the vaccinated group. What's most interesting is they report the mistake they made. So the half dose followed by a full dose actually has an efficacy of 90%, and the 2 full doses was 62%. Now, there are some immunological mechanisms that could explain that, and it'll be interesting to find out once they report full results. But we do know that this group here, the 90% efficacy, were in individuals under the age of 55. So it could just be their age. I think that's unclear at the moment. So hopefully they'll be providing us more information soon. Importantly, this vaccine is stable for at least 6 months at refrigeration. So shipping to various clinics, et cetera, will be really helpful for stopping this pandemic. So let's talk a little bit about distribution. So making a vaccine and producing it is one of the challenges, but the biggest challenge really is, or an additional challenge, I guess, is how you get it to the people who need it. So I've already mentioned the different storage requirements of these vaccines. And so these have to be taken into account in planning that whole distribution and storage issues at particular clinics. So what do we think is going to happen right away? So Pfizer says December 11th, or maybe even on December 10th, if they're approved, that they're ready to ship 6.4 million doses, and these numbers I'm telling you here are just in the United States. They have agreements with other places in the world. You've probably been hearing about the UK has already approved their vaccine. So remember, there's 2 doses for this vaccine, and so that equates to 3.2 million immunizations. So individuals that can be immunized. One thing that we're not hearing a lot about in the public press is waste. So typically, people assume there's about a 20% waste in vaccinations. So that could mean the truck ran out of gas or the dry ice shipper didn't work. The nurse dropped the vial, or it was set out on the bench top too long. So there's like a lot of waste that's associated with, especially with these large mass campaigns. So it really might not be 3.2 million people that get immunized with this first dose. It might be a lot less. But because they're not talking about this, I'm just going to assume it's all 100%. So Operation Warp Speed is hoping that there'll be 40 million doses by the end of 2020, with additional doses from Pfizer and Moderna coming online. And so if you take that 20 million immunizations plus that 3.2, that gives you a little over 23 million individuals that could be immunized by the end of 2020. So who's going to get them? So the CDC has come up with some guidelines, and each particular state is developing their own guidelines. And for the most part, it's thought that healthcare workers will get them first, and people who live in long-term care facilities. And together, that's about 23 million. So by the end of 2020, it's probably just about 23 million people that could possibly, if everything goes 100% well, be vaccinated. Next in line would be essential workers. That would be police officers, firefighters, teachers, perhaps people that keep the economy going, like meat packers, all sorts of different essential workers, which equates to about another additional 80 million. And then we have all those individuals with high risk conditions. So it's going to take a while. Now, Operation Warp Speed said they thought if everything worked really well, vaccines would be available for anyone who wants them in May sometime. And I think they're assuming other vaccines will come online. One of those, there are others, but one of those is one by Johnson & Johnson, which is also a viral vector, but not a chimpanzee vector. It's actually a human common cold virus. They currently have trials of single dose and 2-dose trials. So importantly, if that single dose vaccination turns out to be effective, even if it's 50% effective, it could make a significant dent in curbing the pandemic. And also importantly is that it's stable at -20 for at least 2 years. And they know this because they've used a similar vaccine platform for other vaccines in the past. And at least 3 months at refrigeration, but likely it's probably even longer. So hopefully by the summer sometime, we'll all be able to get vaccinated. But everything has to go really, really right for that to work. And one thing I also want to point out is that these clinical trials were assessing severe disease or people who were getting COVID-19 and becoming ill. They were not assessing if those individuals who are vaccinated could be blocked from transmitting the virus. So if you get vaccinated, it's possible that you will not get ill, or likely you would not get ill, I would guess. But we really have no idea if you could still transmit the virus. So continue to mask up and practice social distancing. All right, I look forward to talking with you on Monday night. Thanks, bye.